G'day everybody, Chris from the Headache and Pain Management Centre here for your Wednesday afternoon. And today we are talking about the psoas muscle, which is arguably the most important muscle when it comes to low back pain. If you're joining me, type in below, say hello. As you can see behind me, I'm actually not in the clinic today. I'm actually in my dining room at home doing some planning for the next 6 months. But it is Wednesday and it means that a video needs to be done. So here we are talking about the most important muscle when it comes to low back pain, and quite commonly one of the more important muscles when it comes to most pain either in your spine or down your legs, and that muscle is called the psoas muscle. So for those that have been to visit the clinic before for their low back pain, most of the time we are looking at a muscle called psoas as the first port of call. Now, a lot of people, when they've had their back pain treated before, haven't had this muscle assessed in the past. And it's because basically it can be a hidden prankster. So effectively what can happen is that it's forgotten because of where it actually is. So the psoas muscle is a muscle that is in the front of your spine, okay? So the spine obviously goes straight down the middle of you. Most of the time we're focusing on the muscles of the back, so there might be muscles called the quadratus lumborum or the multifidus muscles, which are the ones that we look at. But quite commonly, it's actually the muscles called psoas, P-S-O-A-S, which is the main cause of the issue. Now, the reason why this muscle is so important is because if you look at where it actually attaches into, it attaches to the 5 of the bottom 6 vertebrae at the front, okay, and it crosses across your belly button down into the front of your hip. Okay, so it runs like 2 sort of long, knotty, rope-like structures that run down the front of your spine, down into the front of your hip. Now, this muscle is really important because it is the only muscle that crosses your center of gravity. Okay, so it's like the filet mignon of a cow or a horse, or any other quadruped mammal for that matter, or a dog. But with us humans, we've actually got this muscle, and we were able to stand up on 2 legs. So that muscle still crosses the center of gravity, but because it hasn't been a long time evolutionally, in terms of, us getting from being on all fours to upstanding, that muscle has a little bit of a, shall we say, tendency to want it to tighten up. Okay, so if you're sitting for a long period of time, where you're spending a lot of time with your legs at 90 degrees to your hips, so typically sitting is the most common position for that. Sometimes cycling can do it as well. When we're actually bending that knee up towards the chest quite a lot, what can happen is that muscle can become tight and it's not able to relax properly. Now, the cause of that, what would actually happen is it causes you to bend forward, so your chest comes forward. It feels really difficult to straighten up. Like, it feels like that when you get out of a chair, it's really difficult to actually get your hips forward and actually straighten right up to stand up. It's really quite common for people with low back pain in the morning to have this, where you're getting up out of bed and it feels like you're an old person. You've got to sort of really push through to get straight, and it takes a little while to warm up. So that psoas muscle can actually draw things forward. Now, what can happen as a result of that is that other muscles need to compensate to actually make this happen. So the muscle itself can cause pain in your back directly, but then of course what happens is that you've got other muscles up the chain, sort of through your middle of your back, up into your shoulders, up into your neck, and need to do other things to get you more upright. So one thing that we do see, one pattern that is quite common, is that people with a tight psoas with low back pain, where low back pain is the first symptom that they get, quite often they develop headaches or tension headaches, maybe a little while afterwards, sort of within a month. Sometimes it can take, 3 to 6 months or a year for headaches to develop after that back pain. The reason for that is because when you're bending forward like this, in order for your eyes to straighten up to the horizon, you've actually got to poke your chin out. So it puts a little bit of stress up through the neck. It causes that to be sensitized and causes the headaches from there. So this muscle called psoas, it can be called the hidden prankster, where you can have a lot of different undiagnosed problems at the moment, musculoskeletally, so with your back, with your head, with your shoulder blades, and sometimes some problems with the backs of your hips and your SIJ. And that muscle hasn't been assessed before, whether it's tight, whether there's active trigger points in it, whether it's strong enough to perform its role. And of course, what happens after that when you bend forward, the muscles on your back at the other side, so obviously the front is your psoas and the back is your back muscles, because it's been bent forward for quite a long time, what happens is that those muscles at the back need to work harder to actually get you up straight. And if those muscles at your back aren't strong enough to keep you up straight, then basically what happens is that those muscles get weak and tight as well, and just causes a myriad of different problems to happen. So a lot of people that come in with chronic low back pain, it's typically the two things which are the cause. The first one is that tightness in the psoas at the front of your spine, and the second one is a weakness or a lack of strength at the back of the spine, so in those muscles of your back. So when you're going to get your back assessed, the psoas is the most important thing to check. Now, the one thing that I would say about getting your psoas checked is extremely important to get it checked by someone who knows what they are doing in that regard, because quite often when you're palpating through the abdomen, it's actually not possible to palpate the psoas directly through the abdomen. It's too deep, and anyone who says that they can do it directly is, either pushing very, very hard or maybe doesn't know their anatomy. But when you are impacting that psoas muscle and doing a few things to get that moving more properly and a little bit more, how can I put this, a little bit stronger, a little bit more fluid of movement, then all of a sudden everything just wakes up and you're able to stand tall. The back pain is a lot better than what it was, and then you actually add some strength to that afterwards. Now, there's a few people that are treating psoas out there, particularly massage therapists as well, which are well-meaning, that are pushing way too hard on the abdomen, and that can be dangerous. We've got a technique in our clinic that we use, which is much more gentle to get things going. It's using something out of a textbook about 60 years ago, and it seems to work very, very well. And basically what happens is that the muscle then is able to do what it needs to do. We're able to strengthen it up, give you a program to get that muscle, supple, moving and strong again, and then strengthen everything around it so that the chronic low back pain becomes a thing of the past. Hey, I've actually written an ebook about low back pain, particularly about the psoas muscle and also the muscles on the back of the spine. If you're interested in that, just type in ebook in the comments underneath and I can send you a copy of that one. And of course, if there's any questions about psoas or anything else that you'd like me to answer, please type in the comments below and I can start a conversation either publicly or offline with you about all that. Hey, hope you're having a good Wednesday here in this putrid weather outside. I'm not sure you can see the rain outside, but it's bucketing down here where I am. I hope you're staying dry, hope you're staying warm. And again, we will join you once again on Friday for another Facebook Live video. I hope that's been useful for you. Cheers and bye for now.